Let's discuss interviewing about the cough. When a patient presents with a cough, we must first all establish whether it is an acute or a chronic cough. By acute, we mean a cough that had a sudden onset and may continue for a few days or weeks. By chronic, we mean either a cough that began insidiously without a previous invasion of wind and persisted for months or years, or one which began with an exterior invasion of wind and persisted for months or years. First, the acute cough. An acute cough may have any of the three causes. It may be an acute cough in the very beginning stages of an invasion of wind when the pathogenic factor is still on the exterior. It may be an acute cough with pathogenic factor in the interior following an external invasion. And third, it may be an acute cough caused by residual pathogenic factor following an external invasion. For the treatment, acute cough in invasion of wind, we use LI4, lung 7, and bladder 12. Acute cough with pathogenic factor in the interior, we use lung 7, lung 5, lung 1, and bladder 13. Acute cough caused by residual pathogenic factor, same as previous. For the acute cough, external invasion of wind, acute cough, aversion to cold, fever, sore throat, runny nose, floating pulse. Heat or phlegm, heat in the lungs, acute barking cough with expectoration of yellow mucus, feeling of heat, thirst, overflowing, rapid pulse. Residual dryness and phlegm in the lungs. There's acute dry cough with difficult expectoration of scanty sputum after repeated bouts of dry coughing, tickling sensation of the throat. Second, we have the chronic cough. Chronic cough is generally due to either chronic retention of phlegm in the lungs, phlegm which may be combined with dampness, heat, or dryness, or qi and or yin deficiency of the lungs. A very common type of chronic cough is due to damp phlegm in the lungs, which is characterized by the expectoration of profuse white sputum, which is easy to expectorate, a feeling of oppression of the chest, a swollen tongue with a sticky coating, and a very slippery pulse. When phlegm combines with heat in the lung, the cough has a louder sound and is characterized by the expectoration of yellow sputum, a feeling of oppression of the chest, a feeling of heat, and a red and swollen tongue, and a slippery rapid pulse. A common type of chronic cough in the elderly is that due to dry phlegm in the lungs, which is characterized by a chronic dry cough with a weak sound and occasional difficult expectoration of scanty sputum. Chronic cough due to deficiency of lung qi or yin is characterized by a slight cough with a weak sound accompanied by the sign of qi or yin deficiency. For the treatment, cough with damp phlegm, we use lung 5, lung 1, bladder 13, stomach 40. Cough from phlegm heat, we use lung 5, lung 1, LI 11, bladder 13, stomach 40. Cough from dry phlegm, lung 1, lung 7, stomach 40, spleen 6, kidney 6. Chronic cough. Damp phlegm in the lungs. There is a chronic cough with AC, expectoration of profuse white sputum, swollen tongue with sticky coating. Phlegm heat in the lungs. There is a chronic cough with expectoration of profuse yellow or greenish sputum. Feeling of heat, red, and swollen tongue with sticky yellow coating, slippery rapid pulse. Dry phlegm in the lungs. There is a chronic cough with occasional difficult expectoration of scanty sputum, dry throat, swollen tongue with dry coating. Lung qi deficiency. There is chronic, slight cough with weak sound, weak voice, empty pulse. For the lung yin deficiency, there is a chronic dry cough, dry throat in the evening, night sweating, tongue without coating. Thank you for your attention.